Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Vizient Pharmacy Vision Awards celebrate the values and achievement of our pharmacy program participants. The Excellence in Integrated Transformational Practice Award is given to a system that accelerates success in delivering high-value care in the 4 domains of operations: quality, strategic growth, supply chain, and pharmacy. Joining us today from the winning organization, UCSF Health, are Drs. Desi Kotis, Chief Pharmacy Executive, Jessica Galens, Assistant Chief Pharmacy Officer of Business Services, and Erin St. Angelo, Director of Pharmacy Procurement and Contracting. I'm Gretchen Brummel, your program host. Welcome to the podcast and congratulations on this award.
Well, thank you so much, Gretchen.
Yeah, thanks for having us today.
Tell me about your backgrounds, roles, and your organization. Desi, why don't you start?
I'm Desi Kotis. I am a pharmacist trained at the University of Illinois. I was many years in a role in Chicago at Northwestern and was very fortunate to have this opportunity at University of California, San Francisco about 4 years ago. University of California, San Francisco, or as we're known, UCSF, is really a place that we can do so much. There's partnerships with research, with innovation, with the schools. There's a medical school, pharmacy school, nursing school, dental school, allied health school. So quite a bit that we could do. Love living here in Northern California and really am giddy every single morning when I wake up and look in the mirror and know what amazing, talented leaders I will be working with each day.
And Jessica?
My name is Jessica Galens. I'm the Assistant Chief Pharmacy Officer of Business Services here at UCSF. And I've been a pharmacist for more than 15 years, started as a clinical pharmacist in psychiatry, and had the opportunity soon thereafter to start managing the business services division. And that included pharmacy procurement, contracting, finance, and many of the things that I continue to do nowadays at UCSF.
Thank you. And Erin, your background?
My name is Erin St. Angelo, and I'm the Director of Pharmacy Procurement and Contracting here at UCSF. I also went to pharmacy school here at UCSF, and if you didn't know what it stands for, it's You Can Stay Forever, because so many of us stay on for a very long time because of how wonderful of a place it is and how much we care about our patients and what we do here for them. I grew up on the East Coast, moved out to the West Coast, and it's been awesome living out here and coming back to where I started my pharmacy school to work here now.
Absolutely. You can stay forever. That's the first time I've heard that. Fantastic backgrounds. Before we dive into the details, is there anyone else on your team that you'd like to recognize as part of this award?
As you know, it takes a village. I would like to recognize our leader, our Chief Operating Officer, Sheila Antrim, who really is the one that gives us the opportunity to do the best we do. I also would like to acknowledge our Chief Pharmacy Officer, Noelle Chapman. Erin, did you want to also talk more about the team?
Yeah, I think I would be remiss if I didn't mention the pharmacy department really is run off the backbone of our technicians, and supply chain is no different. I think our buyers and our inventory management technicians are really integral in this award and what we do every single day in pharmacy supply chain just to make sure that every patient here and outpatient, inpatient, all of them have drugs. I want to give thanks to them for their hard work every day, not just on this project, but day in and day out.
Wonderful. You won this award based on your excellence in integrated transformational practice. Tell me about your overall approach.
For this award, it really was focused around on the work that we're doing around drug shortages. It's the ever-growing hottest topic or least favorite topic in pharmacy and pharmacy supply chain right now. It's only growing. It's not going away. So we looked at this as it's not any longer just a pharmacy problem. It affects the entire bandwidth of the healthcare system, inpatient, outpatient, retail pharmacy. And we needed to get those involved that are not outside of the pharmacy department as well to really be collaborative and also transparent with what's going on. We really took the approach of transparency to say, hey, this is happening, and then collaboration on how do we combat this to make sure that we are continuing to treat our patients, even though we don't have the drugs, we don't have the ways and means right now, but how can we get there and how can we project this outwardly to maintain that same level of care that UCSF is known for throughout. So it was really centered around that model, and it involved various different teams. So the core of it was our pharmacy supply chain team, so my buyers and our IM techs, and then our operations and clinical leaders, and then it expanded out to the various clinical leaders, physicians, nurses over those practice areas that were affected most by the highest level of the drug shortages. So it ranged from oncology down to radiology, over to our primary care outpatient facilities. And we really had a great response to that. At the highest of the drug shortage that we have, didn't have to change patient care. We didn't have to turn our doors from patients, and we're actually able to take in patients from other institutions to make sure that they were still treated. That collaboration and what was coming up, what supply we had, and that transparency to see the gamut of where everything was throughout our system really, really helped pay off.
Tell me a little bit more about what you did.
We essentially had about 5 hours of meetings a week. One of those was surrounded with just my direct supply chain team, gathering what are our highest priority drug shortages. From there, we created a very big algorithmic sheet that created a run rate of these drugs. Where is the inventory located? When was our last order? What is on order? What are we getting in? You can see transparency in that inventory location-wise, what you were using in the immediate past, as well as longevity-wise. Historically, what was your usage on that? From there, we met with our pharmacy clinical and operations leaders. These are the areas that we recognized are the highest priority right now. We have enough to get through X, Y, and Z weeks or months or whatever the situation might be. Do you have a patient list? We know what patients are coming in now. That we can kind of forecast out. We might not make it. Then we went to our physician champions and our nursing leaders for these different areas to say, here's what's happening, here's what's going on. We then met with them on a weekly basis also to say, what is the state of the union? Where are we falling with all of these different drugs in all of these different practice areas? Do you have a clinical change? Do we need to create a hierarchy of patients model that we need to hit? And luckily, it didn't have to get to that, but we did have that in our back pockets if we needed it. Like if we had to go down a different clinical algorithm, we did have that all outlined. And it kind of helped us predict the future, which is probably the hardest thing to do when you have drug shortages, but at least helped us be prepared for that. And having physicians on board, they're the ones who use the drugs and prescribe the drugs. It really helped catch it in the beginning and where it was, and they knew what was going on, so they can either be more diligent. Let me stack my patients all on the same day if it's an outpatient clinic, or we're going to make all of our times for this one drug inpatient due at the same exact time so we can save on the drug shortages there or less wastage, etc. So really having the full transparency across the continuum of care.
Yeah, I'm definitely hearing that consistent theme about how that multidisciplinary approach has been integral to the success of your program. So thank you for sharing that. I know your organization has been recognized for your innovative and clinical practice in the past. What's the background there?
In the previous year, we were recognized for a couple different awards. One was on our work with the most vulnerable Black African American patients in San Francisco and blood pressure control or hypertension management. And the other was vaccine efforts. So working with the County of San Francisco and having and running a 23-lane vaccine drive-through. And also we had an area, a kiosk where it's near a bus exchange where citizens could come in and get their vaccines. A lot of what we do here is to take care of our most vulnerable, those in most need. It's really proven because we are one of the largest Medicaid providers in Northern California, definitely the largest health system in San Francisco, providing care to those either without insurance or those Medicaid patients. We really walk the walk. We don't just talk the talk. Jessica, did you have anything else you wanted to add on this one?
It really is a collaboration between these teams that makes all of this work. Pharmacy is one aspect, but we really rely as well on the physician leaders and the nursing leaders also, and other social work. We run the gamut here at UCSF, and that makes a big, big difference in what we do every day.
And that's very much aligned with the integrated component of this award. And it's fantastic to see the consistent demonstrated success of your organization in this space. What are some of the financial successes that you've seen from your work?
We have spent the past few years demonstrating the value of the entire pharmacy enterprise to the institution, demonstrating that not only is it important to make our financial contribution, but also from a patient care perspective, as Erin was alluding to. In the past few years, we have garnered over $200,000 worth of savings. We do this with general cost savings ideas as well as revenue generation. And this is so important as we talk about teamwork and really thinking about innovative ideas and testing ideas.
A big thing that we did take away from this is with this collaborative effort, you get less drug waste. If you can stack your patients, if you can figure out times, you can combine vials, etc., you get less drug waste. And even from things that have come up, maybe they weren't super high priority, we have changed drugs that are same clinical and therapeutic interchanges. We have went with a less expensive item that gets the same therapeutic and clinical outcomes, and we had buy-in across the board. So it's a built-in cost savings that came from something that could have been terrible, like a drug shortage, but we were able to turn around same clinical outcomes for a cost savings initiative as well.
Yeah, it's great to hear when you can partner the outcomes and the financial piece of it. So how have you been able to expand your services?
Being here and reflecting on what we've done, as I did go to my mentors right before I started to say, these are some of the big heavy lifts we'll need to get done. And they said, give it 5 years. These items that you mentioned are going to take 5 years. We've been able to accomplish quite a bit in 2 or 3 or 4 years. Really proud of the leadership team. The contemporary leadership structure that was set up prior to myself and Jessica and Erin boomerang back to UCSF, we were really lucky to be set up for success with a chief pharmacy executive, chief pharmacy officer, an assistant chief for business services. So that's myself, Noelle, Erin, and then the team like Erin, the directors, the site directors, the system directors. And without having that domain expertise to really champion what these programs are, so if it's expansion of ambulatory care services, we're putting our first retail pharmacy to motion soon. So some of these things that we're expanding into home infusion, into alternate sites of care, those stories have to be told by us, whether it's within the triad of myself, Noelle, and Jessica, or those directors, our leadership team like Erin and others. We really need to have that correct contemporary leadership structure, being able to tell the story of what we need to do to not only cost save and be efficient, work with our partners, whether it's the providers, the physicians, the mid-level providers, the nurses, the social workers. How do we tell that story the right way so we can explain it and show why it's the best and the best value for our patients?
Yeah, and I totally agree, Desi. I think since I've been here about 3 years now, what we've done a really good job of showing is that pharmacy is a value add. We are not a takeaway from the hospital. We're not a takeaway from the system. It's from these projects and these different items that we've done. And we've shown the value add that we bring to every set of the table. We've been able to grow, and people have the confidence in our team. And under Desi, they really have gained the confidence that, hey, we can give pharmacy these services because we know they're going to be an addition to our institution, not take away from what we've already built. That's the important thing that we've been able to do over how long Desi's been here, how long I've been here, and it's been really, really positive.
Building the infrastructure and making sure that we can handle situations like drug shortages, for example, is really key to being able to build upon that and then expand services. Being able to expand services to meet patients where their needs need to be met is really, really important to us from a clinical standpoint and operational standpoint, but we need to have that infrastructure in place to be able to be nimble.
So what does the future hold for UCSF Pharmacy? Any big plans?
A big place that we're entering into is our retail and our ambulatory space, as well as home infusion. I think that's a big push moving forward. I think UCSF has been recognized worldwide as a top inpatient institution, and we're growing our ambulatory services to be a compendium of care for everyone. Pharmacy is right there up with it. The future of pharmacy is like, we want to be a leader. We want to be who everyone in Vizient is like, oh, let's ask what UCSF is doing and where they're going with this to truly be like that innovative practice and keep pushing pharmacy forward.
Anything else you'd like to share with our listeners?
The possibilities are endless. I always refer to us being on the bullet train. We do have a couple more hospitals coming into our system, another 400 beds. So we have a lot going on. We're also looking at training and layered learning for our pharmacy technicians and the clinical training that pharmacy technicians need for very niche type roles like sterile compounding. We're moving that bullet train.
Always moving ahead. Something that we continue to work on is just keeping in mind that healthcare has to be sustainable as we go forward, and that we continue to add value and drive the care excellence that we are known for.
That's fantastic to hear, and congratulations again. It sounds like there's a good chance that we'll see you again back here in the podcast seat in the future. Thank you all so much for joining us to share your perspectives and expertise. I'm really glad you could be here.
Thank you so much, Gretchen.
Thanks so much, Gretchen.
Thanks for having us.
And listeners, please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.